Assalamu alaikum. Dr. Hussain Baksh Kolachi YouTube channel is with you, and today we will discuss the uh, pandemic of COVID-19, which started in 2019 and ended after 1 year by the 20th to 2020. Its force was reduced, and ultimately it has become uh, kind of disease which is being treated as non-pandemic or a big public health issue, but it can emerge again. So epidemiology, mortality, vaccines, and prevention, these are the three objectives of this presentation. And hopefully it will remind and refresh your knowledge, as well as some of the people who have received the COVID vaccine will recall the fear as well as the panic, and the lockdown word was first time heard by many people. Even cities and countries were standstill, and the trade markets, everything was changed, and the life of the world was affected by the COVID-19. So let us move further. uh, what we can do here. So this is a kind of COVID, which if this panel is moved upward, okay. So COVID is COVID-19 caused by SARS-CoV-2. This is severe acute respiratory syndrome, coronavirus 2. Because coronavirus are of many types, and corona means they are just like moon, and then in the side there is a corona or a kind of circle. So this is also in the same way. The microscopic picture has a central, and then there is a corona or a circle around it, where the spikes of this virus are shown, and we will discuss in detail. First identified in Wuhan, China in December 2019, but as I remember, it was November, and then in December it was officially declared, and the Wuhan animal market or pet market was the considered as the origin of this virus, but still we don't know what had happened and what had not happened. It spreads primarily through respiratory droplet and aerosol. Incubation period is 2 to 14 days. Normally, we ask from our students, because this lecture is aimed for the MBBS class as well as any public health and medical postgraduate class, because COVID is one of the recent pandemic which shaken the uh, world, and it is one of the still in memory, because 2019 is recent, and it happened 100 years in a flu or influenza pandemic. We call it Spanish flu, or that was in 1918, almost a 100 year ago. So nobody remembers, and very few are living souls of that pandemic. After an incubation, the symptoms are common: difficulty in breathing, fever, cough, fatigue, but the very important symptom is loss of taste and loss of smell. So if all these common symptoms and the patient feels loss of taste and loss of smell, then this is perhaps the central point to differentiate our differential diagnosis. So after this, let us move further. Why this is not moving? So global epidemiology, let us talk about the global epidemiology, total cases almost near a 770 million. It means near 1 billion cases, or one-eighth of the humanity suffered in some way or the other way. But if you look at the deaths, then they are almost higher than any war, any world war, First World War, second, and the countries affected 228, almost every country on the planet. So you can see the Europe suffered the most, followed by America, and then West Pacific, Eastern Mediterranean region suffered less, where we are in Pakistan, and even Africa suffered less. So this shows that the Europe and America are more prone to the future epidemic. That is one message which this epidemiology gives. And America is also one of the vulnerable country. Somehow Pakistan managed very well at that time. It was considered that Pakistan is a poor country, but I think with the help of the China, immediate vaccination was started, and COVID vaccination centers were developed, and even Pfizer vaccine was developed by two Muslim scientists, originally from Turkey, but they made this mRNA vaccine, which is one of the important breakthrough in the vaccinology. So after this, let us move further. Mortality rate by age, and you can see the old people suffered more, 80 plus, and then followed by 70 plus, then followed by 50 plus, and children almost, and young people had a very low mortality, and even the 30 to 59, 49, they had also a very insignificant death rate. So this shows that a future pandemic will affect old age population, which is growing particularly in Europe and America. This might be the one reason, because life expectancy of these countries is a risk factor for future pandemic. COVID-19 variant alpha, beta, gamma, delta, and omicron. And you can see that in India and particularly in Pakistan, B1617.2 variant and B1 was a different thing, but you can see that in the South Africa, Brazil, but we are interested in most severe form was in our region, B1.617.2, and followed by Omicron, which was the last variant. And after that, we have heard the little work on the different variant, or because of the vaccination, because of the changing in the population, the virus also changed. So we have alpha, beta, gamma, delta. This can be a postgraduate question, that what are the variants of COVID-19 which are known to the community. So COVID-19 vaccine type mRNA vaccine, we call it Pfizer BioNTech. This was the company which first and very effective vaccine, and preclinical trial was on a very important effect. mRNA instructs cells to make spike approach, and viral vector vaccine, inactivated vaccine, particularly from the Bharat Biotech, Sinovac was the name, and protein subunit Novavax vaccine was one of the important, and the efficacy it was started 66%, but it increased up to 91 and 90%. Global vaccination distribution, you can see that it was distributed initially less, but it was just reaching to every person. But the rich countries hoarded the vaccine and kept for their population. The poor countries were restricted to get the vaccine, or their orders were not honored by the vaccine producing companies. So that was the vaccine politics which we observed. And doses, you can see that almost uh, billions, in more than 12 billion doses the population, and over 13.5 billion doses administered globally as of 2023, about 3 4 years. It means that 8 billion is the population, so almost double than that. Every person or every country got this vaccination, and that vaccination dropped the effect and impact of the COVID vaccine. CDC guideline: stay up to date with the COVID-19 vaccine and boosters. Wear a mask in high transmission areas. Maintain 6 feet social distance. When possible, wash hands frequently for 20 plus seconds. Improve ventilation. Get tested if symptoms, particularly the tasteless or the smell is disturbed. Isolate for 5 plus days and monitor community areas where there is a danger. Prevention strategies: first line of defense, reduce severity and transmission. This is the impact of the vaccine and also death. PPE and hygiene: mask, hand sanitizer, respiratory etiquettes, which is normally you have to sneeze just like in the elbow, so that the spread of the droplet infection is not there. Environmental control: ventilation, surface disinfection, air filtration. These were the important aspects. These are a few questions. First question is: a 65-year-old patient with diabetes presents with fever, cough, and loss of taste for 3 days. He has not been vaccinated. What can be the cause? So you know that this question is clear. Loss of taste and all other fever, cough, they direct the. So option B, option C. Answer for one is option C, which is the risk is 5 to 10%, because 65 years person is in that high risk. And if it is less than that age, then the risk is 0.5% or 3%. But when it is 65, means it is old age, so it comes to the 5 to 10%. MCQ2: a healthcare worker received 2 doses of mRNA vaccine 8 months ago. Which CDC guideline is most appropriate? No further action needed. Receive a booster dose. This is the correct answer. B is the correct. Only wear a mask. This is PPE, and get revaccinated. No booster dose is sufficient, and quarantine for 14 days. So I think question 3: a novel variant is identified with 50 plus mutation on the spike protein and shows 2 times increased transmissibility. Which variant is there? So from this, you can see that variant of interest, variant of concern, and variant of high consequence, and variant under monitoring, and variant being investigated. So it is variant. The answer B is variant of concern because it has a multiple mutations and two times increased transmissibility. Question 4. A 30-year-old patient tests positive for COVID-19 and has mild symptoms. Following current CDC guideline, which is the recommendation, 24 hours after fever resolves, 3 days from onset, and that I should use what is actual question. That I should. So the answer is C. C means question 4C for 3 days from onset. You have to guidelines because it is positive. So wait for the 3 days. That is the correct answer for the 4 MCQ 4C is the correct answer. So with this, I think we are ending our presentation. And if there is any ambiguity, please drop the comments. And COVID was one of the most feared pandemic we have seen in our lifetime. And I hope the lessons learned are that the old age population, rich countries are the targets more of the COVID. And as we move to the poor countries and the young age, the transmissibility might be there, but the mortality and the impact of the COVID was less. I think that was the reason that we people in Pakistan had less mortality. And vaccine was urgently rolled out, and WHO leadership was, I think, acknowledged. And even the countries, poor countries, they supported, but there was vaccine hesitancy and rumors. So these are the few things. Dr. Hussain Bushkolachi YouTube channel is with you. And please like, subscribe. We have discussed this a recent pandemic as uh, we have understood this. And in ISRA University, I was focal person of the COVID. We established immediately a COVID center and vaccinated almost 80,000 doses to the population of Hyderabad and the Sindh province. And I think that service not only saved the ISRA University more than 1,000 staff in Hyderabad, but I think almost 40,000 plus population and the awareness and the confidence given. And we first vaccinated the chancellor of the ISRA University so that people should have a confidence in the vaccine. So with this, I am ending. The students of MBBS of any college can learn from the MCQ and from the latest information. And I think thanks to the AI that now we can develop a very good presentation in a very short time, which I have made this. Thank you very much. And I think learn AI and AI role can be in the monitoring of the COVID also. The background was appreciated by my students today of the fourth year MBBS, where this lecture was fixed according to the timetable. So everybody be safe, and we wish that future pandemic will be dealt as the COVID was dealt with the urgent vaccination rollout and preparation. Thank you very much. Thank you. God bless you. Please like, share, subscribe, and don't forget to press the button of the YouTube.